Okay, here we go. Good morning, everyone. A good day, everyone. Just like I promised to, if I have the time to record myself for this part of the iodine deficiency, chloride deficiency, and fluorosis, just like I promised in the other video clip, because we couldn't meet. I planned to have recorded this together with the other one. But unfortunately, I decided just to come for the class, and something came off that this week, even though I'm around, but it's very difficult for me to make it for the to make it on that Thursday. So I decided to record this part so that maybe next class we can discuss in the next, which is infection, nutrition, and immunity. So I ask you guys to read on that topic so that when we come, we can fully participate. Okay, so this video, I will record the iodine deficiency and the fluoride deficiency separately so that for easy to avoid the even network interruption. Now, starting with iodine deficiency. Now, what is this iodine? We know iodine is a trace element and very important when it comes to some biological synthesis, specifically in the synthesis of thyroid hormones. And we know basically we have two thyroid hormones, which is thyroxine, which is tetraiodothyronine, and triiodothyronine, which is T3 and T4. And these hormones were produced by the thyroid gland. And we know thyroid gland is the gland that is situated in front of the neck, just above the trachea and below the below Adam's apple. So this gland is responsible for the production of these hormones. And for them to produce these hormones, the basic ingredients needed include iodine. Apart from the amino acid tyrosine, iodine play a very important role. And how is this iodine or availability of this iodine determine production of thyroid gland? So if an individual is not getting enough of iodine needed for the synthesis of thyroid hormones, then the thyroid hormone synthesis will not occur. As such, what does this thyroid hormones do would definitely be affected. So shortly we'll talk about how fast these thyroid hormones are synthesized, and we can see how iodine is involved in the synthesis of thyroid hormone. And then we'll talk about the function of these thyroid hormones. And after talking about the function, then we will see how deficiency of iodine affect the synthesis of the hormones, and then deficiency of the hormones themselves, and how does that correlate with the symptoms associated with iodine deficiency, and even the disease conditions, because we talk about iodine deficiencies with plural. So we'll have quite a number of 1 or 2, 3 of these conditions that are linked to iodine deficiency. Okay, now let me explain the synthesis of iodine. After ingestion, iodine will associate to, depending on the source, but we're talking about dietary iodine. So dietary iodine will definitely be associated with organic compounds when it enter into the GIT. And once it enter into the GIT, it got absorbed. Once it got absorbed, the iodine will now be converted to, first of all, about 30% of this is absorbed, of which 70 will definitely be will not be able to be absorbed, but 30%. And out of this 30%, you have up to about 80% taken up by the thyroid cells. The thyroid cells will take out to 80%, whereas the 20% will now be taken by other cells and then finally excreted out of the body. And once excreted out of the body, then the 80% taken will now be metabolized by the body. Okay, so once the 80% taken by the thyroid cells will take this iodine through what we call ATPase-dependent sodium potassium pump. And this pump is responsible for the transportation of iodine into the thyroid cells. Shortly, we'll talk about how this pump has been involved in inhibition and some antithyroid activities, which we will shortly talk about goitrogens and how goitrogens work. So once iodine is taken, the iodine is oxidized to iodide by the iodine is oxidized to iodide by thyroperoxidase. So thyroperoxidase uses NADPH to convert oxygen to hydrogen peroxide. So hydrogen peroxide is now used for the oxidation of iodine to iodide. So iodide is now in a form in which it can interact with thyroglobulin. And thyroglobulin, this is the major protein found in the thyroid cells. And once it binds to thyroglobulin, because thyroglobulin contains a lot of tyrosines, amino acids, a lot of them. So amino as iodine will bind to thyroidine to form monoiodotyrosine. Another one can bind to form diiodotyrosine. So because we have so many of them, one will bind to just one thyroid amino acid, while some will bind to two to form diiodotyrosine. So we have a combination of diiodotyrosine, we have monoiodotyrosine. And this step is called iodination. In the next step, we have what we call coupling, where diiodotyrosine or two diiodotyrosine will come together to give tetraiodotyrosine, or rather tetraiodotyrosine, which is one of the thyroid hormones we talked about. And then we have diiodotyrosine also combining with one of the monoiodotyrosine to form triiodotyrosine, which is the other thyroid hormone we talk about. And all this takes place in the parafollicular cells outside the thyroid cells. And after the synthesis, after this synthesis, the whole thyroidoglobulin will now be taken up by the thyroid cells through phagocytosis. And then once it phagocytosizes, or rather we use phagocytosis, because phagocytosis is a bit peculiar to phagocytes. So through phagocytosis, once it is taken, then this body will now be stored in the thyroid cells. So this is the major storage form of iodine in the thyroid cells in form of thyroid hormones. And of course, some of them might not actually combine with each other through coupling process to form either of the thyroid hormones. So of course, you can have some maintaining as diiodotyrosine and then monoiodotyrosine. So you have this combination in form of a body engulfed by the cells, by the thyroid cells. And whenever there is a signal for the need of thyroid hormones, then a proteolytic enzyme will be released. This is based on the stimulation by the pituitary gland, which secretes TSH, which is thyroid stimulating hormone. So you have a lysosome will be mobilized, and it will come and fuse with the the body containing the thyroglobulin, and this thyroglobulin containing all these hormones and the diiodo and monoiodothyroidine. So once the lysosome collides with or coalesces with this body to form a secondary lysosome, the hydrolysis, of course, will take place. After the hydrolysis will release these thyroid hormones, and the thyroid hormones will be taken into the blood and then move to the body for their function, while the monoiodothyroidine and diiodothyroidine can be reused through the iodination by the iodinase to form the tyrosine and iodine, and then the iodine will go back to the thyroperoxidase, then converted to iodide, then from iodide, iodination, and then the process continue and a recycling of this process. So we talk about the function of this thyroid. So after the formation of the thyroid hormones, what does the thyroid hormones do? We already talked about it is very important, or the major function in controlling basal metabolism. So it controls metabolic rate. When the metabolism is needed at higher distance speed, when it is needed in a lower speed, and majorly, how is it involved? It must definitely, for it to perform this function, involved in carbohydrate, lipids, and protein metabolism. So it is also involved in calcium homeostasis, because we talk about parafollicular cells, and these parafollicular cells majorly are involved in the synthesis of calcitonin, and we know calcitonin is the major hormone involved in the homeostasis of calcium. So, and we know calcium is involved in development of bone. So we'll see how this can somehow be related with also, because of course, when the thyroid glands got a problem, then the production capacity of calcitonin will definitely be affected as well. So we talk about also controlling the body temperature, brain development, bone development, etc. Okay, sources of iodine. What are the sources of iodine? So the major source of iodine is actually seafood. They are the major sources. That is why we will find out the areas that are mostly affected with iodine deficiency happen to be areas that are far away from sea, that have no access to food that comes from sea. So apart from that, but you still have some certain level of iodine in soil. So even if you're far away from a sea and the soil around your area contains a certain amount of iodine, that can be enough for you to cater for the need. But if it does not, then that will reflect the iodine concentration even in other cereals, even the meat, because of course the meat iodine content will definitely reflect the iodine content in the cereals you take in, the vegetables, and the water you're taking. So if the water, the cereals, and the vegetable doesn't contain, of course, if the meat will definitely will not have. So it's just a translation of what you have taken from the vegetable and those things. So we just mentioned seafood, which like seaweed, fish, shrimp, etc. And then we talk about the dairy product like milk, yogurt, and cheese. Recommended dietary allowance. So the recommended dietary allowance of iodine differs with the stage of development or developmental stage. Like the children, the children of 1 to 8 years, 9 to 13 years. We have male and females of age 14 and older. Then we talk about the pregnant women, and we talk about the lactating women. You know, we talk about basal metabolism. And of course, when we talk about basal metabolism differ in individuals based on even body size. So based on body size, you of course talked about age. And you also talked about a rapidly growing cells. We talk about pregnant women. So the pregnant women is not a land. A pregnant woman is herself and the growing embryo. And you remember the growing embryo contain an embryonic cells, and embryonic cells are one of the typical examples of a rapidly growing cells. So of course, they need a lot of iodine for maintaining the basal metabolism. So also in the case of lactating of women, etc. So iodine deficiencies. The iodine deficiencies, just like I mentioned, disorders refers to a spectrum of nutritional or health nutritional related disorders resulting from inadequate intake of iodine. And this covers from intrauterine to adulthood. So the effect started even at the embryonic level to the adulthood. And in adults, we have hypothyroidism, goiter, and then we have cretinism, basically, and mental and growth retardation in the case of children. But the most important disorders we'll talk about is hypothyroidism, which of course, while discussing hypothyroidism, we would discuss hyperthyroidism, and we talk about goiter, and we talk about cretinism. Now, starting with goiter. Goiter is just a swelling or enlargement of the thyroid gland. And this is as a result of just an uncontrolled growth of the cells, and maybe resulting or as a result of hyper or hypothyroidism. So in either case, the hyper and hypothyroidism lead to increase in the size. We'll see how this is actually linked to the role of thyroid stimulating hormones, because once the iodine is needed, or once the thyroid gland synthesis of thyroid hormone becomes low, it simply tells that the maybe the iodine is not available. So the important thing now, the pituitary gland will stimulate the production of thyroid stimulating hormone, and often release the thyroid stimulating hormone will increase the intake of iodine, the uptake of iodine through regulated, because we mentioned how this thyroid stimulating hormone is actually involved in controlling the ATPase dependent sodium potassium pump, therefore facilitating the or stimulating the intake of or uptake of iodine from the blood circulation into the thyroid cells. So you have this part. So when you have an increased thyroid stimulating hormone, too much thyroid stimulating hormone, and the individual does not have iodine or is not taking food containing iodine, and this pituitary gland will keep on releasing thyroid stimulating hormone, and this can lead to enlargement of the thyroid gland, leading to the goiter. And in the other case, we have also other situation where you will have a high production of these thyroid hormones, but abnormality can lead to either secretion of the thyroid stimulating hormone by the pituitary gland, or you can have a situation whereby we'll explain some conditions how this thyroid stimulating hormones activity is being mimicked by some other proteins, which lead to enlargement of the thyroid gland. So the size of goiter indicate the degree of long-standing deficiency. So based on that, the WHO categorize this goiter into 3 stages based on the thyroid size. We have a passive, maybe this is called G0, which is a condition where you have the deficiency is actually there, but there is no passive and no visible goiter. You didn't feel it, or you didn't feel any enlargement around the area where we have the thyroid gland, and there is no any visible goiter as well. So that is the first one. So, but that deficiency has been established. So we also have G1, where you have a perceive, you feel there is a kind of enlargement, but when your neck is on a normal position, you cannot see it. At G2, the goiter is visible, even when your neck is in a normal position. So you have the goiter still. So this is basically the class. So we talk about the hypothyroidism, and we say simply it results when the thyroid gland fail to produce enough of these hormones. And this can be related to or attributed to quite a number of factors. And the major one, I think, that is much more relevant to what we're talking about here is the inadequate dietary intake. So of course, if you are not taking food that contain these things, the condition comes in. And we have an autoimmune condition we call Hashimoto's disease. I will explain Hashimoto's disease. We also have the disorder of pituitary gland. So we have disorder in pituitary gland where the pituitary gland is unable to produce or to induce the formation of these thyroid stimulating hormones. We also have a case of pregnancy where one major hormone, what do you call this hormone, HCG, human chorionic gonadotropin, is involved, and this hormone may cause an overactivity of the thyroid gland, and this can cause enlargement. We also have a cases of goitrogens where you may be taking this iodine, your food contain iodine, but at the same time taking some food that contain goitrogens. And these goitrogens are nothing but compounds that actually inhibit, they're also called anti-thyroid. So they inhibit the uptake of iodine. And when we say they inhibit the uptake of iodine, we definitely referring to the ATPase dependent sodium potassium pump. So these compounds inhibit that pumping mechanism, like thiocyanate, thianoglycosides, etc. And even some drugs like thiourea, thiouracil, and even the oral contraceptives. These oral contraceptives can actually also cause the inhibition of this iodine uptake leading to a goiter. And the hypothyroidism is associated with a decrease in basal metabolism, high heart rates, the body temperature, weakness, dry skin, and weight gain. So the opposite case in hyperthyroidism, just where we have a higher intake of iodine beyond the over tolerable limit. This leads to quite a number of consequences, although the consequences are far less detrimental than as in the case of deficiency. Hyperthyroidism now is associated with the increase in metabolic rate, anxiety, increase in heart rates, body temperature, and weight loss. So these are the basic symptoms associated, and in comparative terms, where you can have a weight gain in the case of hypothyroidism, we have a weight loss in the case of hyperthyroidism. So we then talk about cretinism. Cretinism is simply a congenital disorder associated with iodine deficiency at prenatal stage, at prenatal condition, or during prenatal development rather. And this is characterized by dwarfism and mental retardation. When we talk about mental retardation, apart from mental retardation, we have the miscarriage, can cause miscarriage, stillbirth, stunted growth, the retarded growth, which make an individual to not to grow properly, to look like a dwarf, even though he's just from the pictures you can see they're actually old women, but they looking like children. Sorry, their body size is like that of a children, but partially the older, by mere looking, you know that this is an old person. It also causes some cognitive impairment, like inability or difficulty reading, writing, talking, solving problems, social skills, etc., etc. That's cretinism. So we then talked about other related conditions like Hashimoto's disease, and typically what happens in the case of Hashimoto's disease is a condition, an autoimmune condition where the immune cells actually attack the thyroid gland, and this causes the thyroid gland to be unable to produce the thyroid hormones due to the damage and inflammation. And of course, the pituitary gland will now release thyroid stimulating hormone, telling the system or the thyroid gland or thyroid cells to take up iodine, thinking that maybe it's because of deficiency of iodine. And this too much production of thyroid stimulating hormone will be responsible now in causing the increase or enlargement of the thyroid gland, leading to goiter as well. So we talk about grape disease and also another autoimmune disorder that has to do with the production of a protein that mimic the thyroid stimulating hormones. So the protein produced will act like thyroid stimulating hormones. And even though the pituitary gland does not, because maybe the thyroid function is normal, but this protein will keep on stimulating the thyroid gland, and this instant stimulation can cause the enlargement of the thyroid gland. We also talked about thyroid nodules, which are the irregular roots of the thyroid cells to form a lymph, and this can be mono or can be multinodal. So in either case, you can have these nodules forming thyroid cancer, even though thyroid cancer is a bit different from other cancers. Very less common because generally it is treatable, and only a few cases of like 5% of the thyroid nodules actually have to do with thyroid cancer. So we talk about pregnancy involving the HCG human chorionic chorionic gonadotropin. We talk about the inflammation of the thyroid leading to thyroiditis. And this could be as a result of the autoimmune disorder we just explained, and it could also be due to viral or bacterial infection. So diagnosis, how do you diagnose? How do you know whether there is deficiency in iodine in the system? So by checking the thyroid hormones, the T3 and T4, using maybe immunoassay. Of course, if the iodine is deficient, these hormones will be very low in the system. But you also have a situation you can check the thyroid stimulating hormone. So of course, when the iodine are not available, then you will have high concentration of thyroid stimulating hormone. You can also have urinary iodine concentration. The urinary iodine concentration gives like a current status of iodine deficiencies. Tell you if the iodine deficiency started just a few days ago, to tell you. But serum thyroglobulin and thyroid size of the thyroid would tell you more of a long term. But the most reliable one is actually urinary iodine concentration. And that one also, when taken maybe over several times within 24 hours, and then you take the medium measurement, that would be more guaranteed than any of those ones. So in a situation that is not possible, you can take the urinary iodine concentration to creatinine ratio, and that would also suffice. So then supplementation, iodine supplementation. Quite a number of intervention by WHO, United Nations, and International Council for the Control of Iodine Deficiency Disorders I've come up with quite a number of approach to reduce this deficiency or problem associated with iodine, like the use of iodized salts, which are very common, and I think we all know that one. And then we have iodized water, we have iodized oil. That one basically for injection in the cases where it is very severe. Then we also have iodine tablet. There are also multivitamin minerals, of which some of the minerals include the iodines. So I think that's all. So I will create a separate one on fluoride deficiency and fluorosis. If you have any question when we meet for the class on infection, nutrition, and immunity, then you can raise your questions there. Thank you.